Good morning, everyone. Welcome to the North Carolina Latino Community Task Force. My name is Marlene Castillo. I am the Community Development Director here with the Mexican. It is a pleasure to have you all here with us and our guest speaker. I know a few faces are new, so I do want to go over our agenda real quickly, very brief. So we'll start with our welcome message, our guest speaker. We'll do some community partner updates, and then we'll conclude our meeting. So the purpose of this meeting is to be the voice of the community and to advocate across different sectors in North Carolina. We have three main goals: to be a multidisciplinary task force focused on Latino and marginalized issues, to intensively collaborate with local community partners, community members, and federal and state representatives to educate the communities on resources that are available or any up-to-date news. And lastly, to engage in our role as leaders and have consistency in our work. So this morning we have Carolina Cecilio Perez. She serves as the Latinx and Hispanic Policy and Strategy Project Manager, where she focuses on enhancing linguistical and culturally appropriate resources for Spanish-speaking communities in collaboration with North Carolina Department of Health and Human Services. Her role builds on a deep commitment to equity, informed by personal experiences navigating language and cultural barriers. Carolina holds a bachelor's degree in liberal arts and sciences from UNC Asheville, reflecting her dedication to education and social advocacy. With over 7 years of public service and local government, Carolina has worked as an interpreter, communications specialist, and community outreach coordinator. Her achievements include helping implement the UT visa policy for undocumented victims of crimes with the Buncombe County Sheriff's Office and supporting bilingual COVID-19 communications to improve vaccination access for Latinx Hispanic communities. Catalina's long life advocacy for educational equity, language access, and social justice highlights her dedication to creating inclusive, equitable systems for marginalized populations. With that, if we could welcome Carolina and thank you for joining us, I will hand it over to you.
Thank you, Marlene, for that wonderful introduction. Just a few updates, and you'll see that in one of my slides. I have been acting director of policy and strategy for the Office of Health Equity since, I believe, August of last year. But I will share more of those updates about our team since we have been able to hire a project manager that we're very excited to share and tell you all more about. I'm going to try to share my screen, Marlene. I think I should have host abilities. Okay. Let's see. Okay. Great. So thank you again for allowing me to be in this space and introduce a little bit about the work that my team does and a little bit more about the department. There's a lot of new faces for me on this call, so I'm always thankful anytime I get an opportunity to share about some of the work that we are developing or we have been working on. And I'll be telling you all a little bit more about that. And of course, we'll have time for questions. Since I am newer to the space, I thought it would be good to start with a few of our updates. If you all haven't heard the great news, we have a new secretary. Secretary Sangbai has joined us as of early January, and I'm going to start by showing you all our organizational chart just to give you all a picture of what NCDHHS consists of, what teams, what divisions, what offices, and how our team collaborates across the department to carry out different sectors of work, different topics. So I'll show you here, as you can tell, we've got our new secretary. Oops, it's moving a little faster. So our new secretary, these are the different divisions that we have listed here. And the buckets of work at NCDHHS, as you can see here, are divided with these deputy secretaries. And so our office, the Office of Health Equity, lies under Deputy Secretary Deborah Farrington. And our director for the Office of Health Equity is Portia Pope. And the work that my team does is right under Dr. Portia Pope, along with the Office of Rural Health and the Olmsted team, and we form part of the health equity portfolio. For those of you who may not know me, I wanted to tell you a little bit more about myself. I moved into this role after 7 years as a public servant in Buncombe County and local government. I joined the team in August of 2023 with our former director, Jasmine Garcia Rico, who we miss dearly. I know you all are very familiar with her and her work. She left us in April of last year, and I have been serving as acting director since. I'm from Western North Carolina. I was born in Mexico. My parents are migrant farm workers, and I grew up in Western North Carolina and in Florida as we followed the seasons as migrant farm workers. I went to Brevard College. I have a bachelor's degree in English literature back when I thought I wanted to be a teacher. And I had DACA, so at the time I wasn't allowed to become a teacher, unfortunately. But I like to think that now I have the opportunity to teach others about the immigrant community, about our lived experiences, about health. And so this is a wonderful opportunity for me. As Marlene mentioned when she introduced me, I also worked for the Buncombe County Sheriff's Office, where we worked to improve relationships with immigrant communities to make sure that especially victims of severe crimes had the opportunity to speak up, to seek help, as we saw with a lot of cases that were often afraid to come and seek the help and services that they needed. Um, Here at NCDHHS, we have been able to collaborate with many of our divisions. Last year, as you all know, Medicaid expansion was the highlight of just reaching more than 600,000 individuals in North Carolina who have now been able to enroll in Medicaid. We know that there is still a gap in coverage, and Latinos who are eligible for Medicaid but may not be aware. We also know that there are still a lot of members of our community who are not eligible for Medicaid. And so as we move through our work and considering and thinking about access to care, a lot of this year will be focused on helping our community members understand their access, the pathways for accessing care and medical support. So, like I shared earlier, in November, our team was expanded by Victoria Zampieri. Victoria is a wonderful, wonderful health navigator. She formerly worked as a Medicaid navigator and brings just a breadth of experience. We're very lucky to have Victoria. She is actually in a training this morning with Medicaid and Care Health Share this morning, so she wasn't able to join our call. But I'm very excited that she's joined our team and really adds capacity to our ability to be able to help others understand pathways to care. So last year, the Office of Health Equity developed a couple of great new initiatives, one of those being our Community and Partner Engagement Guide. The reason why I wanted to highlight that this morning was because as we think of what opportunities the department is going to continue to have to support communities who are really experiencing a difficult time, um, we want to be able to support you all. We want to be able to engage. And so revisiting this guide has been very important for framing the way that we collaborate and engage with different organizations across the state. As I shared, the health equity portfolio is a part of the work that we do. We collaborate with these different teams with operational excellence, Olmsted. We think about the department's sustainability, our ability to recruit and retain talent that can serve our bilingual and bicultural community here in North Carolina. And so this is a little bit more about what the health equity portfolio's mission and vision is. And we also have something called the Health Equity Framework, which means that our communities are at the center, that we work to engage and sustain the work that groups like these are doing. And we want to listen, we want to understand how our programs can better serve our community, how our initiatives can better serve our community. And so by centering this framework, working on this framework, expanding on it this year, we'll have an opportunity to think through how we can improve different areas. For example, we are looking at some of the concerns that we've had with, for example, our vital records teams, right? What happens if there's something wrong on your birth certificate, on your child's birth certificate, and you need to get that fixed so that passport can be issued correctly? Well, that part of the amendment process is something that we handle, and we're looking into that. And that's an example of how a community concern can be brought up to our team, and we work to navigate and see how can we strategize, how can we come up with solutions that can improve a service or a way information is delivered. Another example of that is the work that we've been able to do with our partners out west. Our hurricane relief weekly meetings continue to take place week after week. We have different conversations where we introduce resources, grant opportunities. We have been able to welcome different disaster case management from either Catholic Charities. Now that the state has been able to hire new disaster case managers, introducing those to the team, we've been able to bring FEMA to this group of about 10 to 15 Latinx and Hispanic serving organizations out west. And we're able to troubleshoot and think through what are some solutions, how can we think out of the box creatively to help the victims and survivors of Hurricane Helene ultimately reach that long-term recovery that they are still seeking. So as I mentioned, we work a lot across the divisions, across the department to produce and provide support. We partner with many different divisions like the Division of Child and Family Wellbeing, which, as you all know very well, Francisco Guzman forms part of. We also work with the Division of Public Health, the Division of Health Benefits, which brings us Medicaid expansion. And a lot of those benefits, Office of Rural Health, which I see some of our colleagues are actually on the call this morning from the Office of Rural Health. So we work across the department to really streamline strategies and help those teams engage and involve our community organizations and individuals into just providing feedback and improving the way that we see and understand our communities. So another example of that is our outreach for the MAC and BAC, the new North Carolina Medicaid Advisory Committee, and the Beneficiary Advisory Council. This is going to be a new formalized way to get input to improve NC Medicaid. And in order to improve NC Medicaid, in April of last year, CMS released its final rule ensuring access to Medicaid services. This is the rule that requires state Medicaid agencies to create a Beneficiary Advisory Council known as BAC and the Medicaid Advisory Committee known as MAC by July of this year. These groups are designed to center the lived experiences of beneficiaries, their families, and caregivers, and these two groups will provide a more formalized structure for beneficiaries and interested parties to provide feedback to the state about Medicaid and Medicaid services. The MAC will replace the current Medical Care Advisory Committee, MCAC, that advises NC Medicaid on health and medical care services. And so we worked to create a map that outlined how these different districts that will have representation in these groups can reflect communities like ours. This is just an example of the different organizations. Obviously, it's not all inclusive because we're very fortunate to have a wide array of organizations serving our Latinx and Hispanic communities. And so there will be one representative from each of these districts. The idea is that those who were interested had an opportunity to apply, fill out the application, and they are now undergoing the review of those applications. Even if, let's say, we didn't get picked to be one of those individuals to serve on the MAC and BAC. We created this map to help us understand as well who would we be working with collectively in each of those districts to make sure that our feedback, that what we're hearing about the way these services are being delivered can make it back to the committee or the council and continue to find ways to gather input to improve NC Medicaid. And so that is what the MAC and BAC will be providing insights on. It can involve anything from coordination of care to the quality of service to the cultural competency, language access, and diversity of services. It can be anything involving beneficiary and provider communications and other issues impacting health and medical services. So as we shared with the map that we're sharing with you all, the MAC membership is going to be composed of at least 20 members, with members selected from those 14 congressional districts that we just shared on the map. And additionally, 6 at-large members. This is a little bit more about that membership, but essentially by July 9th of this year, Medicaid will have produced the bylaws and the recruitment processes would have been in place. This includes selecting, creating that member selection criteria, which has already been established. We're now at the phase where those applications are being reviewed, but this will also include onboarding, and the team and the council, the committee and the council themselves will have a lot to do with how this is all established. Term lengths, how members roll on and roll off, compensation, and existing committees can be adapted to meet requirements of the BAC and MAC as long as the existing committees meet the new requirements. And the state has declared and publicly posted bylaws the group is being used to fulfill the BAC and MAC regulatory requirements. The meeting and frequency will also be determined by the group, but there are some requirements. Both the MAC and BAC must meet once each quarter. And the reason I'm sharing this with this larger group is because this is how we will know the opportunities, right? How often do we have an opportunity to provide input to that member from our district? They must offer rotating meetings, participation options, which include an all in-person, all virtual, and hybrid attendance. And regardless of the meeting format, a telephone dial-in option must always be available. These are just some examples of ways that they have been trying to expand to make sure that recruitment is accessible for the wide array of participants that will be both on the committee and the council. And then 2 MAC and BAC meetings per year must be open to the public with dedicated time for public comment. And so when those dates are established, this group and many others across the state will have an opportunity to come to those open meetings and have time for public comment. So like I shared, these MAC and BAC members are going to be selected by the Deputy Secretary of Medicaid. The interested parties have already submitted their applications and they're currently undergoing review. So that is an opportunity that our team has worked to share with different organizations across the state to make sure that we can ensure that we have ample representation on both the committee and the council. And pivoting to another subject area that we'll be working on this year is talking about access to care. As we have been sitting in different spaces in the first month of the year, we realized that every individual will have an opportunity to decide how to best seek care for them and their families. And one way that we want to contribute to that is making sure that individuals know the wide array of services that are available to them, whether that's through federally qualified health centers, like Advanced Community Health in our area here, or maybe even considering free and charitable care clinics. We have maps that we're sharing with our community partners so that they can put in that information and find where these resources are closest to you. We're actively connecting with other partners that may provide dental clinics or other ways that our community can access services that may not necessarily be through Medicaid and participating providers, but other ways that our community can continue to access and receive the care that they need. Another example of this is looking into the project access programs. And then thinking through, apologies, these slides are in Spanish, but thinking through these strategies and solutions collectively as we continue to sit in spaces where we're allowed to receive feedback and listen to everything that is happening on the ground. We can come back to the table to think through brainstorm, how can we connect them with a provider that has maybe connected to us and said, we really want to focus on this section of health, or we really want to focus to provide to this population. And often that is the opportunity that we have with the Office of Health Equity. It's that partners often come to us and ask, what can we do? How can we help in this area, in this that community partnership model is what really allows us to connect different individuals and community organizations to the services that they need. I did want to quickly share that we also have an opportunity to apply for the summer internship program. This is for HBCU and minority serving institutions and students from minority serving institutions to apply to form part of our internship program that is coming up in the summer. Applications are due by February 20th. So if you all know any students that would be interested in participating, I would highly encourage them to look into this opportunity. I'm also sharing now these QR codes. This is just an example of some of the different reports that are available that discuss some of the work that the Office of Health Equity and the Health Equity Portfolio is working on. We publish a bi-monthly bilingual newsletter where we publish different community events across the state, work opportunities, career opportunities within NCDHHS and our partners. And so I highly encourage you all, if you have the opportunity, to please sign up for that newsletter. And if you have any questions, I'm going to stop sharing so I can probably see if there's anything in the chat for me. But again, thank you all so much for letting us. Yep, that's right. Someone is saying I don't have access to the chat while presenting. Apologies. That is correct. How do we sign up for the email? I'm thinking we're referring to the bilingual newsletter. Let me drop the link to the chat since I know that our QR codes are not always the easiest to pull off information from. I'm sorry, Marilyn. I didn't have access to the chat to enlarge the PowerPoint.
Thank you, Catalina. So we're going to open up the space. You guys are welcome to unmute and ask me questions about the presentation. Thank you, Catalina, for that detailed presentation on the work that NCDHHS is doing and the work you're doing. We truly appreciate it. I will start it off with Juvencio, and then we can see if anybody else has any other questions. You might be on a call. So is there anybody who has any questions or comments about the presentation Carolina shared? If let's We have one from Belen. Thank you, Belen, for asking. How do folks with questions get in contact with your resources? Is it a direct contact?
So I can drop my email in the chat. Yes, you all can reach out to me or Victoria directly. And I'm also leaving you in the chat a link to subscribe to our newsletter. Our newsletter generally shares the latest NCDHHS information, programs, grant opportunities, updates. All of that it's typically included in the bilingual newsletter.
The next question is from Mariana.
In terms of
I'm sorry. I think it's my end. Our internet is lagging today, so I do apologize. I'll hand it over to you, Carolina. And I'm gonna mute.
No, thank you, Marlene. So I see Mariana's question about programs and updates, upcoming events that we can share. We actually just last Thursday, had a cafecito on mental health and access to behavioral health centers. We will have another one in March, and those are town halls. They're streamed on Facebook. and they're usually about an hour. We typically have a provider, a community health center, or a community organization featured on the panel, and we talk about what resources are available. For example, we had one, I believe in November, if I remember correctly, maybe December, on respiratory health. So any opportunity like that, we make sure that we share via the newsletter. And then NCDHH has on their website, if you ever want to visit their news section, there we are constantly and regularly publishing different press releases with our latest and most up-to-date information.
Thank you, Carolina. We won't take more of your time. We do appreciate you coming on and joining us and sharing these updates. If there's any other questions, you guys are feel free to just put them in the chat. We'll get them over to her, or email her. I know she provided that information as well. But thank you again, Carolina. It was wonderful, and we'll move on with our agenda. So the next thing that we had was, let me pull it up real quick. Oops. Updates. So I'm going to go down our list. If you guys could please say your name, your title, organization, or agency that you work for, and any upcoming events that you guys may have. So I'm going to start off with Amanda Norwood from New Bern.
Okay. All right. Whoops. I think I'm not sure if my camera and stuff is working, but anyways, thank you so much. We work with refugees that have come in through the U.S. Program. So right now we're not expecting new families, but we are continuing to work with the families here, and both in New Bern and in Greenville. Some resource, we have our fundraiser event that will be coming up, Dinner on Five Continents, which will be on our webpage, which is www.helpingrefugees.org.
We can't hear you, Marlene.
I'm on mute. I apologize. Sorry. We next is Ashley.
Hello. I need to turn my camera on. My name is Ashley Tauscher. I work with the North Carolina Human Trafficking Commission. And honestly, I always get emails about your events and things like that, and I've always wanted to join. And today seemed like a good day. And just to see if I learned any information that might be helpful for us to share through our website. Our website, it's North Carolina Human Trafficking Commission. If you just Google it, you can find it. And I'm the court management specialist there. So, yes.
Thank you for joining us today, Ashley. I'm just going to keep my camera off because of the lag, so I do apologize for that. I do see Carolina, your hand is up.
Yes, Ashley, when you said what your line of work involves, I thought about the policy that was mentioned in my bio, the UNT visa policy, and how we were able to partner in Buncombe County, and I think this could be easily replicated maybe in other counties, but we partnered with our domestic violence programs there. It's called Our Voice. We partnered with Physical Legal Services. I know there's an equivalent of that in Sea Justice Center, ACLU, but the idea was that we were able to partner with different organizations that were bringing this to these concerns to local law enforcement about human trafficking, about how people are less likely to report crimes or labor violations if there is a fear that will jeopardize their ability to continue to work and thrive. And so I would encourage you to look into those models and establish those conversations in your community about what can be done to continue to protect and create safe spaces for individuals that may want to share important information or concerns.
Yes, absolutely. I did see that. That's awesome, that you were able to work on getting that policy established. We do definitely share information about the visas that are available to human trafficking victim survivors. Um, and especially now, these days we do think it's really important that people know that those options exist for undocumented victim survivors of human trafficking too. So thank you so much for sharing that.
Awesome. Well, thank you for joining us today too, Ashley. Next I'll go with Belen, and I do know she had mic issues, so I don't know if you want to just put them in the chat and we can all read that as well. I'll move on next to Benjamin.
Hi everyone, I'm Benjamin Nogueda. I'm with the Mexican Consulate, and we don't have any upcoming events, so I think that's all. Thank you.
Oops. Thank you for joining us today, Benjamin. Next I have Blair.
Hi, I am an intern with ECU Health Cancer Care Services. And some few upcoming events we have our free mammogram breast clinic screening tomorrow for women that are uninsured in Pitt County.
Awesome. Thank you. If you have a flyer for that, we'll be happy to share that on our socials. Next I'll move on to Carlotta. Good morning.
Good morning, North Carolina, Carlotta Dixon, North Carolina Department of Health and Human Services, Division of Social Services, have nothing to report.
Thank you for joining us this morning. Next, I have Carolina Hunter.
You got it right. It's another Carolina. I'm the community collaboration specialist with East Coast Migrant Head Start Project. I'm new to the role, so I'm really just trying to kind of see what services are out there for our families. So we have 43 educational centers in the whole state, and we serve over 3,000 children. This is for migrant worker families. So if you have any kind of resources or anything, feel free to send it my way. And I just posted our website also in the link.
Thank you for joining us today and for sharing. Next, I'll move on to Francisco. Good morning, Francisco.
Hola, good morning. I hope everybody is doing well. I would like to remind that this month is February dental reminder for everybody, specifically for children and youth. And I'm sharing a tool that maybe it could be useful for families with special healthcare needs. And actually, the Division of Child and Family Wellbeing is doing trainings as well, specifically for providers and community members with families with special healthcare needs. Thank you.
Thank you for joining us this morning and for sharing. Next, I have Glorstein. Good morning.
Good morning. I wasn't looking for my name to be called. I am Glorstein Brown. I serve in the North Carolina House of Representatives, Pitt County, District 8, and I was just here to listen and to learn.
Well, thank you for joining us this morning. We appreciate it.
Thank you.
Next, I have Jalen Harley. Good morning.
Good morning. How's everyone doing? My name is Jalen Harley. I'm the business and industry liaison for Southeast Nonprofit Housing. Even though we have housing in our name, we offer career services as well as some housing benefits. We are still within our first program year, so we don't have any upcoming events quite to say, but we are working to partner with various organizations in our service areas across North Carolina, and we are looking to enroll as many people as we can. So if you think any eligible people would qualify for our program, please send them our way. We assist agricultural workers and farm workers um, as well as the migrant seasonal farm workers. Thank you. And I'll drop my email in the chat.
Thank you. We appreciate it. And thank you for the help you're doing for the community. Next, I have Luis Garcia.
Hi, good morning, everyone. My name is Luis Garcia Bundis. I work at the Department of Health and Human Services in the Latino Office of Health Equity. And we actually have a meeting coming up this Friday. I'm going to put the link here in the chat. It's the 2025 Community Health and Wellness Symposium at UNC Pembroke. And we're going to have two members from our community engagement team on a panel. It starts at 9 a.m. and it goes until 4 p.m. So feel free to check that out. It's at UNCP. I'll also put down in the chat my email if you guys want to reach me for following up with any questions. Happy to assist as best I can. Thank you and excited to be here.
Thank you for joining us this morning. Next, I have Mariana.
Hello, my name is Mariana. I work at a federally qualified health center called Contentnia Health. We have a few locations, one in Pamlico, one in Greene County, well, Pamlico County, Greene County, Pitt County as well. My office, the few offices that I work at is the Contentnia Health Greene Clinic. I also work at the KB Reynolds Contentnia Health Clinic. I also work sometimes at the Student Health Clinic we have behind Greene Central High School. But what we do is we offer services on a sliding scale fee. So we actually charge patients based off of their annual income. So we have a large majority of uninsured patients that we serve. We're in like a really agricultural area, so we serve a lot of farm workers. We also have neighborhood health services who go out to farms in the area, and they'll actually check the blood pressure and the blood sugar of a lot of farm workers. So that's one of the initiatives that we do. My job is just case management. So I'll identify high-risk patients with our doctors, and I'll work with them. For example, I just recently helped somebody apply for Medicaid, which was really great because their daughter really needed it. But yeah, so I just, do assessments on them, trying to determine what is their level of need, and then work with the patient. I'm also bilingual as well, so I help out our English and our Spanish patients. And we don't necessarily have any upcoming events going on at this time.
Awesome. Well, thank you for joining us this morning. Next, I have Marilyn. If not, we'll move on to R, Saenz.
Good morning. My name is Ritza Sáenz, and I'm the breastfeeding support specialist, and I work for the Orange County Health Department. And I'm here. I was invited for a friend too, and I'm here just to learn, to help, and serve better our community.
Thank you for joining us this morning. Next, I have Scarlett Chavez.
Hi everyone, my name is Scarlett Chavez Larios, and I work at DHHS under the Office of Rural Health with the North Carolina Farm Worker Health Program. My role really focuses on, so I actually work under our digital equity and inclusion team, and I focus on a hotspot lending program that we have, and also I am currently trying to compile a list of health education topics and just like digital literacy topics and resources for our ag community. I specifically work with basically all farm workers like statewide. We're just trying to, get as many resources compiled and also like trying to make sure that farm workers have access and are connected. We don't currently have any events, but we're hoping to have some, later on this year. But yeah, anything that you guys like have questions on, or if you have any resources that you'd like to share out, I think that a lot of you guys work in work that's very like pertinent to like what we're doing, and so I would really love to like collaborate and keep coming to these meetings. So thank you for having us.
Thank you for joining us, Scarlett. We appreciate it. And then not lastly, I'll go back up to Curtis Hill. If not, we'll go to Vanessa Rico. Oh, I'm
All right,
sorry, Curtis.
sorry about that. About that. My name is Curtis Hill. I'm with Disability Rights North Carolina, and we're doing a vaccine project where we're trying to make sure people with disabilities and seniors have access to vaccines, and you can follow our events um, throughout on our website at disabilityrightsnc.org. That's part of our project for the last couple of years since COVID, to make sure people have access to flu and COVID vaccines across the state of North Carolina, people with disabilities and seniors.
Thank you, Curtis, and thank you for sharing. Next, I have Vanessa Rico.
Hello, everyone. My name is Vanessa Rico, and I work with Southeast Nonprofit Housing. We don't have any upcoming events, but I would like to share that we're looking for more partners and referrals. We work with agriculture workers and their families, providing emergency assistance as well as career advising. This includes tuition assistance, fees-related assistance, transportation, and housing services. Thank you.
Thank you for joining us today, Vanessa. So I'll go next to Marilyn.
Hi, good morning, and thank you for this invitation. Marlene, I'm so sorry when you called my name. I just moved for a moment for my desk. I work with the Office of Equity and Inclusion in Orange County. And I work with the different departments, and one of them is health department. That is why I have the interest in know how things are going with that community and appreciate it. As you know, equity and inclusion now is in a very red line, so I don't have so much updates. But I'm happy to for this invitation and meet all you. Thank you.
Thank you for joining us. We appreciate you joining and listening in. Did I miss anybody else on the call? If not, we'll move on to Mexican updates. So the first one I think a lot of you guys might be interested in. I did hear a lot about the farm worker community. We are going to be having our second annual Latino Farm Worker Conference, investing towards the future of agriculture. It will be in Pitt County at the NC Cooperative Extension Building. We have spaces available, so we will be sharing that link in the chat. We are going to be providing a light breakfast and lunch. So we do hope you guys are able to join us that day. We do have some great speakers lined up for this discussion and some great questions we want to hear more input from you guys about and strategize ways that we can better support our farm worker community and our agricultural community. Next we have this. I will pass it over to Rodolfo.
Hi, sorry, Marlene and I are in the same office space right now, and both of our internets it's not working. What is it that you're sharing on your screen, Marlene?
Know your rights information session.
Okay, awesome, awesome. So again, hi everybody. Wish I could show my face to you all, but it only makes the lag a little worse. So my name is Rodolfo Martinez. I serve as the director of the Advocacy and Civic Engagement pillar here at the Association of Mexicans in North Carolina. We would like to cordially invite everyone to our Wilson Know Your Rights information session with the Sheriff of Wilson this Thursday at 6 p.m. We want to create, after legislation passed around December with the House Bill 10, forcing sheriffs to cooperate with immigration and customs enforcements. And under current and new administration, our community has been a little bit more afraid, and we just want people to know how they can stay the safest and be up to date and informed with the correct and factual information, knowing what the sheriff's department does and knowing what the police department does. We will also have representation from the district attorney and chief of police as well. And it'll be a bilingual space, and we're hoping everyone comes out and enjoys. And it'll also be online on Facebook Live as well for those that aren't able to make it in person.
Thank you, Rodolfo. Next, we have the People versus Griffin. If you want to share a little bit about this one as well.
Yes. So as everyone can know, all North Carolina races have been confirmed except this one, in which it's Mr. Griffin and Mrs. Riggs. Mr. Griffin is currently challenging 65,000 North Carolinian votes. So after 3 recounts, and so in collaboration with North Carolina Common Cause, Democracy North Carolina, Blueprint North Carolina, Kinston Teens, and a lot of other organizations. This Sunday, we will be having rallies across all these different cities across North Carolina. A Mexican will be present at the Greenville one. It will be at Boyd Lee Park again this Sunday from 1 to 4 p.m. If anybody would like to come, I'll put the registration link in the chat, and everyone and anyone is welcome. I'll also put a link to check if your vote has been challenged through this.
Thank you, Rodolfo. And on the left, we do have a flyer. We are going to be having a reunión informativa, so a formal meeting on Saturday the 15th from 11 to 1 p.m. in Grifton, NC. This is in collaboration with some local churches, where Mexican is working with the collaboration of these churches to provide services and offer the resources that are available to the community. The programs and services include education, health, advocacy and leadership, art and culture, and binational initiatives. Next, we have FAFSA Day. This will be on Saturday, February 22nd from 9 to 12 p.m. This will be at the Mexican Educational Community Center on Belvoir Highway. This is where we'll be helping students fill out the applications and any questions or concerns they or their parents might have. And items are required. So like the parents' tax information and the list of colleges and things like that. But if you register, we'll be sharing more information on what they need to bring the day of. Next, we have the clinics of defense. So I'll pass it back to you, Rodolfo.
Thank you, Marlene. So in collaboration with Interbanks Legal Services throughout the year for 2025, we will be hosting joint monthly deportation defense clinics. So anyone that has any deportation orders, it doesn't have a status, or is just worried, even if they do have a status, they're welcome to join, see how they can stay as safe as possible when they do encounter ICE, whether it is at their house, on the road, at the store. And these are great spaces. And if we do have a sliding, these are all free, but those that do if for people that are below the 200% poverty line in North Carolina right now, they are able to get a one-on-one free legal consultation regarding the deportation defense. Alongside this, we're also hosting free powers of attorney in case worse comes to worse, and these families are unfortunately separated, and at least they would have a plan of what to do. You know, what happens to their money in the bank, their children. It's unfortunate, but we're glad to be able to offer this at zero cost to families. And again, these are monthly. The dates change month by month, but they'll typically be within the last week. We share the actual address upon registration, just because we don't want to put out the actual address in case of any harm being done against our community and for people to feel even more safer.
Thank you, Rodolfo. And then next is our emergency call, so I'll pass this over to you as well.
Yes. So A Mexican now has a emergency call center. Feel free to call any of these phone numbers if you see something, document it, and want to share it within our community, not only for ice raids or ice sightings, but also just in case of any emergency. We're glad to be able to announce that in collaboration with generous donors, churches, and community members and businesses were able to have an emergency fund for community members. So we're just excited to be able to help the community in more ways this year than we have in the past. And these are just numbers that people can reach out to, text, and we'll be right on in contact with them.
Thank you, Rodolfo. And then our
And if
last
we're not
event,
able to assist them, we'll be able to refer them out.
sorry, thank you, Rodolfo. Our last event that we'll share today is our International Women's Day. It will be on March 8th from 12 to 2 p.m. It will be at the South Greenville Recreation Center. If you guys are interested in joining, please feel free to reach out to Frida. Her information is on the flyer, but we will also be sharing this information in a newsletter. But other than that, I will turn my camera back on. Hopefully, I don't lag as much. But I want to thank you guys for joining us and for being patient with us with this internet issue we've had. Thank you again to Carolina for sharing the information that she did. And thank you to our partners for joining us on this call. We appreciate it, and we look forward to seeing you next month. I hope everyone has a great week.
Thank you.
Thank you.
You.